Thank you very much. Welcome all to the last panel here. So I'm very excited to have three persons with me on stage. I would like to start with the brief overview, what we're going to discuss, right? So like with a looming global healthcare workforce shortage, can technology bridge the gap, or do we simply need more trained professionals? So this is the first part we are going to talk about today. They have been already introduced, like Lucas, Philipp, and Simon. So we are going to have three different questions. And I would like to start with Lucas, with my first question. So the World Health Organization has predicted a global shortage of 18 million healthcare workers by 2030. From an investment perspective, how are you seeing this crisis evolve, and how can investments help address it in both the short and long term?
Yeah, very relevant question, very big problem. And so we have maybe two cents about what I do to put this into perspective. So I run an early stage venture capital fund, mainly focused on health and education. We like to invest into digital business models that tackle society's biggest challenges. And ensuring a high quality health coverage is one of society's biggest problems, as I believe, so everyone should agree. The shortage of qualified personnel is at the core of this healthcare coverage. We have explored different angles and also did several investments that could tie into at least parts of solutions to this problem. I mean, the most obvious and however the most long-term solution would be, okay, we need more qualified people. Fortunately, those qualified people don't grow on trees, and you can just tap in, you can try to, I don't know, accelerate international mobility. I invested into a company called CareLoop from Berlin that is really focused on training, educating people in areas of the world where there's no shortage of qualified personnel. There is some of those areas. There's, I don't know, northern African regions, you have the Philippines, Indonesia, Brazil, Mexico also. But still, it's difficult moving hundreds of thousands of people across the globe, including their families, right? So this is rather a long-term thing. Then what I firmly believe in is, what we did is to look at how healthcare workers spend their day-to-day, so the kind of tasks they go about. Doesn't come as a surprise. A lot of tasks, especially on the admin side, are not yet automated. They believe there's a lot of potential, and ultimately the goal there should be to increase the time spent on the patient, because we firmly believe that you cannot automate the human touch or like human interactions. This should not be the goal ultimately, but the goal should be to maximize the time spent on the patients or patient-facing activities by healthcare workers. And then a third bucket that I believe is quite promising as well. If you look in more like what I was touching on before was more admin-related tasks. If you look at more medical tasks, also how can you make medical procedures more efficient? And how can you make medical treatments more efficient? Also did an investment that's based in a company from Portugal called Uphill Health. They try to, based on a lot of data, they draw up clinical pathways once patients enter the clinic, and already proved that hospitals working with their solution were able to increase the efficiency by factor 2, which is also another angle you can play. So bottom line, lots of different approaches. I believe that this is one of the major challenges of our time, but challenging times also come with opportunities, and I believe that there's a lot of potential out there.
Okay, thank you very much. So in the second part we come exactly as well, talking more about the technology part of this question. So Philipp, then you, the European Investment Bank has a strong focus on sustainable projects. How are you addressing healthcare workforce challenges within your investments? And what strategies are being put in place to manage the increasing demand for healthcare professionals?
Yes. So also to give a bit of a context to it. So I work for the European Investment Bank, and within that, in a team that is advising the EIC fund on its equity investments. The EIC fund is the venture capital arm of the European Union, and we are we built. Since 2 or 3 years, we became one of the largest and most active deep tech VCs in Europe. Healthcare is our single largest vertical, so I would say we have quite a good view of what's going on in that sector. And I think similar to what Lucas said, we have, first of all, before you look at the investment strategy, you have to define the problem and what it means for your organization or in your view. And for us, I mean, is definitely there is a global shortage of healthcare workers that is not going anywhere anytime soon, simply because we have a growing population, we have an aging population, we have a rise in chronic diseases. This is particularly important because those type of patients, they need more active and more frequent medical care. At the same time, we have bad working conditions for the healthcare professionals. They work a lot of overtime. It's not well paid. So we saw, since COVID, obviously, healthcare professionals leaving the space. And all of that leads to a decrease in the patient experience, a decrease in the quality of care, and an increase in wrong diagnosis, in human error. So that is, and of course, you can look at it, migration can be part of solving this issue. Education, getting more people in the sector can be part of the problem, but for us, speaking with an EIC view, it's clearly the technology that is actually, for us, addressing, or it's the key to address the problem in the future.
Thank you. So you were paving now the stage for Simon. Now we are talking about technology. So Simon, from this point of view, how do you see the relationship between the shortage of healthcare workers and the technological solutions Microsoft is developing? And can technology truly fill the gaps? Or is the human element irreplaceable in healthcare?
Well, firstly, thank you, and let me sort of just really sort of agree with my fellow panelists here. But before I come to the central question, let me just maybe just contextualize the challenge a little bit further. I spend most of my working life traveling around the world talking to healthcare organizations from Australia, Southeast Asia, the Middle East, all over Europe, and the Americas. And when you're talking to them about the biggest challenges they have, it's not the cost of medicines. The cost of medicines is a big challenge, but it's not the biggest. It's not that they don't have enough beds in a hospital. That, by the way, is also a big challenge. We've talked about aging population, COVID backlogs, etc. The biggest challenge in healthcare globally is that we do not have enough clinicians, healthcare workers, to get through the current workload we've got today, never mind the backlog from COVID, never mind the fact that we've got an aging population, that older people use care more, we all know the arguments. We can't do it today. And we've talked about migrating people. There has been some migration. What typically happens is that very wealthy countries take clinicians from poorer countries. They've been doing that for many years. That isn't solving the problem. It's exacerbating it in other countries. It's not solving the problem. So the only solution we have is to use technology. Now, I do feel quite strongly that we've got to think through how we use technology. I do think the clinician is incredibly important in the process. When you're at that vulnerable point, you do want to have a clinician with you. And I think that I would go one stage further. When we think about technology and when we think about artificial intelligence and technology, one of the things that I have regular discussions internally around is keeping the clinician in the loop. I think the moment you start taking the clinician out of the loop, that becomes tricky. And I think that using technology to make clinicians more effective, more efficient, is incredibly powerful. But I don't think we're talking about replacing them. And I'll give you an example. If you've got a pump I want that pump regulated because if the doctor or the nurse walks out the room and I've got something in my arm, I want to be pretty sure that it's gone through some fairly important testing to ensure it's not going to go wrong. But when you're talking about technology, whether it be generative AI, predictive AI, this is with the clinician in the loop. And I think that's the key piece to bear in mind.
Mm-hmm. Thank you. Now we were talking more about, in general, about technology. Now let's focus a little bit on AI, right? So how you see like AI as a tool or can be used for example, administrative burdens in healthcare. So what's your opinion on specifically AI? Yeah?
To me?
So, yeah?
So we've looked at multiple forms of AI. The part of AI that we are particularly interested in at the moment, and we spend a lot of time on, is generative AI. Mm-hmm. And so you will see, and certainly Microsoft is doing this, there are other players in the market doing this, but can we use artificial intelligence from a generative purpose to remove some of the administrative burdens that we place on clinicians to make them more efficient? And I've seen lots of data banded around by various different organizations. But it saves up to half a clinician's time, roughly, by doing this. Now, this is not routine administrative tasks, that is a box-ticking exercise. These are critical parts. And what we're really talking about, administrative tasks, is clinical documentation. You can't not do clinical documentation. It's part of the care process. It's part of the handover of care. It's part of the treatment, the diagnostics, the care pathways. You've got to do it, but it is enormously burdensome. And it, when I see different parts of clinical documentation, often it's linked to reimbursement, so it depends on the health system. So when you say, state-sponsored healthcare system that you might find, say, in the UK with the NHS, it's on the lower end, maybe 40% of a clinician's time doing clinical documentation. When you go to, countries where clinical documentation is almost directly linked to reimbursement, it's much higher. Although I do think the trend will be that clinical documentation increases. The more data in the system is going to be powerful for so many reasons. So it's a trend that's going up. And I think if we can use generative AI to drive down the time the clinicians spend up to half, that would be important. The other factor I think to bear in mind is how much do healthcare systems spend in these on people. It varies again on health systems, but somewhere between 40 and 70% is a pretty good stat. So when you think of all the spend in healthcare globally, where do we spend the money? The biggest by a mile, by a country mile, is people. So we're already spending a fortune on it, and we can't solve the problem. So I do believe we're going to need to use generative AI to get over not just the hump we got today, but for the future as well.
Thank you. So let's zoom out a little bit again, Philipp, and we have been discussing this topic as well, like what role do you see, for example, in robotics and automation in healthcare sector? And perhaps you can give some examples of some portfolio companies you have, right? And are these technologies ready to scale, right, in a way that can mitigate workforce shortages?
It's a very good point, because also obviously we see a lot of companies here and we see a lot of pitches, and a lot of the very good solutions there are based on software, right? So it's typical because traditional VCs, they like software-based businesses, something which doesn't cost too much, that you can easily scale if that's possible in that sense. So we are also from the EIC fund, we are also focused on hardware, which costs a lot of money, high risk, because simply as an EU fund, we believe that this is also the way we need to go to facilitate and attract other investors to that space. So why is it important? Because software is a part of the solution, but it doesn't go without the hardware. To give you some examples from the portfolio companies that we have one company based in the Netherlands that is developing a device, a machine that is taking blood from patients. I mean, it makes sense. It's a very standard process. If you get a nurse doing that job 100 times a day, the likelihood of errors occurring are increasing with the number of times she's working there throughout the day, and how busy she is, how stressed she is, and what so on. On the other hand, this machine is doing it, and it can do it up to 1,000 times a day, exactly the same thing and the way it should do it. The only barrier there is obviously patient's acceptance, right? Because do you want to be strapped to a machine and then a needle comes out, and even though you know that it's way better than a human being is doing it, it will take time to get there. But it's one way to look at, you know, what can actually technology and robots do there. The second thing is a company we have in Lithuania, and they are developing an endovascular device, a robot, which the surgeon can control from a remote location. Initially, the plan was to protect the surgeon from the X-rays, which makes sense, but subject to regulation and subject to, let's say, internet connection. Basically, you can do that from anywhere in the world. And that's quite interesting if you think about such diseases where, you know, you have a heart attack, every minute counts. You might not have the time to be flown into the next hospital 100 kilometers away, but you might have such a device where the surgeon can actually operate this device from, you know, I don't know, the capital, and does it in a remote location, 100 kilometers away. So back to your question, we do believe that robotics particular play a very important role in addressing this problem, particularly when it comes to remote locations. It will take time because regulation obviously is one barrier to that. Acceptance is another barrier to that, and yeah, as we saw in that sense, broadband internet, which even in Germany, for example, is not always a given, is also a requirement that needs to be there in order to scale that, but the potential is there.
Cool, thank you. Lukas, on your end, when evaluating investments in health tech, how do you assess technologies like AI and robotics?
It's a very broad question, but I try to answer it in a bit more concise way. I mean, both are groundbreaking technologies, right? With a multitude of potential use cases in healthcare. Maybe first tackling AI. You see, over the last one and a half year, there was just a multitude of companies rushing into the market. One sector or one area where we saw a lot of movement, and also there's some companies here today, especially ambient AI solutions used for documentation. I think that's a no-brainer. Saves a lot of time on the clinicians, also on the care side, so non-doctor nurses. I feel that their technology is more or less on the verge of being commoditized. It's more of a like really integration and execution play, so partnering up with the right partners, EHR players, for instance, that can really give an edge. We have not made an investment in that area yet. This might change shortly. Let's see. There we see a lot of potential. When it comes to more really medical tasks, I mentioned this briefly. We invest into a company called Uphill Health from Lisbon, from Portugal. They are technically not an AI company, but it's more rule-based decision-making. I think the result is the same, so from technology perspective, it's a bit different. What they have come up with is essentially a medical co-pilot for the doctor. As soon as a patient enters a clinical environment, as soon as there's a first diagnosis, this patient is being sent on a clinical pathway. So then based on results of examinations, certain exams being executed, meds being prescribed, this patient, the path of the patient is optimized. And already today they're able to increase the efficiency of the treatment and the time spent in hospital by 2x, which is significant. And now if you now we've all talked about the clinical context, but I think where there's a lot of potential also is the non-clinical context. So what happens at home, and how can you prevent hospitalizations to happen in the first place? Because this is extremely, puts a huge strain on our healthcare systems in general. Then there's also a lot of potential. And then maybe talking about robotics, wearables, if you think of fall protection, or fall detection, protection. Maybe there's airbags. I think there's airbag solutions as well, but yeah. There's also a lot of potential there, and just trying to enable people to live a more autonomous life longer, and try to reduce the number of hospitalizations or rehospitalizations after they've been released. There's also a lot of potential there. Yeah.
Okay. Now, good point. Now let's go back to the humans, right? So while to you, Philipp, while technology is a critical part of the solution, right? So there will always be a need for human expertise in healthcare, obviously. So how do you envision a future where human workers and technology are integrated to complement each other?
Yes, I have the feeling the three of us are all going to be aligned on this, and then Simon actually mentioned it as well. I think it doesn't go without the human, right? So a successful solution or technology should focus always around, and that's what we also see, should focus around how can you actually enable the medical workers, the physician, on doing more of the stuff that's adding value. So get rid of the annoying, let's say, the dump work, which is standardized, which takes a lot of time, but actually takes away the time where it's needed. So I think going forward as a patient, they need to accept, we all need to accept that there will be more and more robotics. But still, the focus will then need to be on the human, to be on the let's say, empathy side of things. Maybe we know that an AI diagnosis tool probably knows better than your doctor, but still, if your doctor has the time to listen to you, to listen to your concerns, to answer your questions, those type of things are actually, in our view, the ones that are added value. And so all the tools that we are looking at should be the ones, as Simon also said, directly linked to the workflow, either directly integrated in the existing workflow or linked to the workflow in the sense that it enables the physician or the medical staff to do more of the added value work.
Simon, what's your opinion on this one? So you're building a lot of digital solutions from Microsoft for health professionals, right? So what's your vision for how this will work together in the next 5 years?
Yeah, I mean, I think, both of you are absolutely right. I think there are an awful lot of companies in this space. I think there are a few lessons, and I'll speak from a personal perspective. Certainly I've seen and learned, and I think that there's a general consensus around this. The first is you need to be in the clinical workflow to make this work. If you're not in the clinical workflow, it's very, very hard to make it work. And being in the clinical workflow is a high bar of entry. So there's lots of technology that you can have that is standalone. It can be SaaS, it can be cloud, but how is it ultimately in an integrated, well, in firstly the clinical workflow and integrated, so you really are with the clinician hand in glove. And I think that is quite a differentiator for a lot of companies. When I'm talking to companies, I'm thinking about either partnership or other areas. I'm looking at that question of how are they in the clinical workflow? And then the second question I'm usually thinking around is it integrated? And we spend an awful lot of time integrating our solutions with partners, electronic health record partners, EHR partners in particular, but not exclusively. We think of the diagnostic sector as well. And again, I think that is also a high bar of entry for a lot. And looking at that innovation that is in the clinical workflow and integrated into the clinical workflow, I think is pretty interesting. And then, as it were, hand in glove with the clinician. The second area, which we haven't actually touched on that much, which I'm particularly interested in as well, is that over the last 50, 75 years, traditionally investment has been in the acute sector, the secondary part of healthcare. And it's done for lots of reasons. It's the biggest, it gets the most money, but ultimately also it's the safety net. So you could almost let, and you could argue some health systems have done this. Let other parts of the health system fail, whether it's intervention, it's prevention, it's primary care, tertiary care. The acute sector now is under enormous strain. Some would argue it's failing in some markets. And I think that is going to bring a rebalancing of what we see, and there will have to be investment, particularly in the primary care sector, and particularly in technology. And if you can sort of hit the holy grail of being in the clinical workflow, being integrated into the ecosystem of healthcare, and if it's nudging into that primary piece, that's a really super interesting, and I think an area we'll look to the future in terms of generically how healthcare is working. We'll see if it manifests, but I think that's a particularly interesting area right now.
Mm-hmm. Thank you. Last but not least, Lucas. So you as an investor, how you think about the healthcare organizations should balance, the need for automation with the essential role of human healthcare professionals?
Yeah, I think my fellow panelists have touched on the most important points. No, I mean, and also based on my previous answers, I think it's quite obvious that we believe in a balance of the two, right? We believe that human interactions should remain at the core, that enabling healthcare professionals to maximize the time spent on the patients, or like enabling them to focus on patient-facing activities is central. I don't think that we're at this point yet where we can get rid of the human element. If you consider loneliness, especially in the older ages as well, this is again a huge risk that we're facing. I think there's a lot of studies out there saying that being lonely is as bad as smoking 2 packs of cigarettes a day. And then for most, also especially elderly people, the doctor or the medical staff are one of the few personal interactions they can still hold on to. And yeah, I don't think that there'll be a future anytime soon where we can get rid of the human element.
Cool. Thank you. So we are already at the end of the session, so happy to take any question from the audience. So there's a unique opportunity having this brain power here on stage. So please use the opportunity. Anyone?
Yeah, I think over there.
Are we on? Excellent. I'll stand. Thank you so much for bringing us home today. Sarah Milan from the Johnson & Johnson Foundation, and we focus on the health workforce as the cornerstone of healthcare. I'm curious about your thoughts for community health workers, because they play such a critical role in extending healthcare, but they operate in settings where the digital infrastructure doesn't necessarily support AI at this point in time, or isn't as fertile, should I say, for AI. How do we, in this room and beyond, work together so that we're not widening some of the health equity gaps, but at the same time embracing innovation? So not one before the other, in parallel.
Who wants to take the question?
Maybe just one initial thought that I had. I mean, it's a very valid point. There is examples of solutions out there that run on ordinary hardware, on-premise, that don't even require Wi-Fi, and that just are very easy to use. I think UI and UX play a major role in the adaptation in the workforce. You cannot build something that is great on paper, but then that the people that are supposed to use it don't understand. There's an example of a company in the documentation space that did an amazing job. Can you mention them by name? They're called Voice from Berlin or from Potsdam, where they focus on nurses primarily in documentation. They have like one smartphone per unit. This smartphone does not require Wi-Fi. It is shared among the different nurses, and as soon as it connects to Wi-Fi, it uploads everything and puts all the data into the electronic health record. I think this is a very good example of how an easy-to-use solution that does not require anything fancy on the hardware side, and it's easy, that can be successful. And I think implementation, adaptation among the workforce is crucial.
Simon?
Yeah, I do agree with you. I think that, you know, ambient is a fairly obvious use case that you could use, and we've touched on ambient before. I think you can, in a sense, I remember having the discussions in a former life where, in a sense, you could have the conversation through ambient, and as the healthcare worker is moving in the community to a different site, picks up some 3G somewhere, and it's there done, and at the end of the day, they're coming back and, in a sense, signing through the various different bits. But there's a sort of tangential point here, which I think is also important, is where you use this technology. And we talked about, you know, primary, acute. The other area is around specialities. You know, where is the weight of clinical documentation? Primary care for sure, because of the triaging. Emergency room A&E for sure, because of the triaging. But actually community care, older person care, and actually mental health as well. Those are the areas where you have huge weights of clinical documentation. And actually, it's really important that you use it first in the areas where you're going to get the most return on investment. You know, orthopedics is wonderful, but how many times are you going to get the savings by, you know, Mr. Jones came in for a hip replacement, Mrs. Jones came in for a knee replacement, again, you know, you're not going to get the ROI to the same level you are in primary care, in emergency room care, in community health. And I think the technology there can play a huge role because of the nature of the speciality.
Does that answer your question? No? Thank you.
Okay. Hello. I would like to give my perspective and also ask a question. So I believe I have a completely different background. So I'm a doctor. I'm the healthcare provider. I'm an ENT and sleep doctor. I'm from Brazil. I validated my diploma, so here in Spain at the moment, I've worked in managerial roles, worked with startups. I advise startups today, which is nice because you're always learning something from the other side. And the more I look at it and talk to, let's say, with these companies and approaching the market, I think there's a huge gap between the technology that is being created and the, let's say, the actual work of the doctor, and also the relationship between the doctors and the managers, because the doctors feel like they're being left behind. That's exactly what you feel like when you're working. They feel like this technology is coming, but they're not involved in the process. And many times there's this new technology that is being bought by a hospital, but it doesn't really actually, sometimes it's not needed in that context. Sometimes it could be, you know, worked if you had some discussions, if you asked the opinion of the doctors, right, the nurses, you know. So sometimes it feels like, to me, there's a huge gap between the technology that is out there already and like how poor the management is to deal with this kind of thing. Maybe also the doctors, how they interact with it. Maybe doctors could also improve communication. Well, that is 100%, but let's say Simon mentioned that he has been talking to healthcare leaders all over the world, and is this, let's say, decisions that are being taken by the managers, are they, how is it discussed? I mean, do you have, for example, implementation processes when people hire your services? Is this like a, you know, combined approach on the decision making? And have you seen cases that it didn't work because of the management?
I think the question goes...
I think, yes, I think the question went to me. I mean, you make a really good point. And I've spent many years, not just at Microsoft, in healthcare and health tech. And many, many years ago, I worked for a company called Cerner, which was an electronic medical records company, which has been subsequently bought by Oracle. And so I think I can probably say this. It's probably okay to say it. And I remember at the time, I'm going back many years, is that we were selling electronic medical records to CIOs, not medics. And I came in as head of strategy and identified that we had a problem. And the problem was that CIOs were buying these systems, techies were buying these systems, and none of the doctors and none of the nurses were using it, and we had a problem. And in the United States at the time, there was a role called a CMIO, Chief Medical Information Officer, and it only really existed in the United States. And I didn't look after the United States, I looked after the rest of the world for strategy. And so I thought, that sounds like a remarkably good idea. Here we have a doctor who actually is interested in technology, but a clinician. And as anybody who's ever worked in healthcare knows, the managers don't run it. Healthcare is run by doctors and nurses, by clinicians. And so I ran a campaign with a media outlet, initially in the UK, and then the rest of the world, to create a role of a CMIO, or CCIO, Chief Clinical Information Officer. And it started to work. And now you go around the world and you will find CMIOs around the world. But I did it selfishly because I wanted to create a role that was going to be my primary buyer. I knew that we needed to sell to clinicians, not to managers, because it was clinicians that used these clinical solutions, this clinical technology, and it was clinicians that could take clinicians with them on the journey around implementation and execution. And that was also a challenge. And so I wholeheartedly agree with what you're saying, and I think it's something that I certainly saw nearly 20 years ago. We're not there yet, but it's very different to where it was 20 years ago, and I'm sure it'll be very different in another 20 years.
Thank you. So we are running a little bit out of time, so I think we close here the session, but we are happy to answer questions afterwards as well. So thank you very much, all of you, for being on stage with me, and have a great rest of the evening. Thank you.
Thank you.
Thank you.